So thank you for having me today. What I wanted to run through is some frequent information that I provide in the outpatient setting when I'm meeting with patients and we talk about aid service. I want you to be able to think about what types of aid service are available, how to pay for that aid service, and then how do you find it once you decide all of that, okay? If you look in your welcome packet, you should have a grid that's titled Needs Assessment Worksheet. Does everyone see this? It's a 2-page document, okay? It's actually from the National MS Society, but it breaks down really well some different tasks that you may need assistance with, so I thought I'd bring it to you all today. I'm going to give you all just 2 minutes to look through. I want you to, if you've got a pen in front of you, mark for you personally those different tasks that you see on the left there and whether you may need assistance with those. Don't get too nitty-gritty about who's going to provide the assistance, but just say, oh, laundry, well, that's maybe something I could get some help with, and I'll give you a couple minutes just to go through and maybe mark some things down, okay? Okay, I'm going to move on to the next slide, but if you're still working through it, feel free to continue, okay? This slide has a lot of information, but we're going to kind of take each column individually. So the first thing that's important to know is what kind of aid service are you asking for, okay? That's going to be important in order to be able to find somebody who can provide that type of assistance, but in also knowing how to pay for it. So if you look way on the left-hand side here, you see Certified Home Healthcare Agency listed up at the top in blue. Okay, these are medical services. This could be changing a dressing on a wound. It could be providing range of motion exercises. When you look at the needs assessment that you were just looking at, page 2 at the top says medical care. That's the first bracket. That's what we're talking about. So if you marked that you needed help with some of these things, this is the type of assistance you're looking for. It's from a certified home healthcare agency. This is the only type of aid service that is covered by Medicare. Okay? Medicare is a federal program. So regardless of whether you're from New York State or from another state, this is going to be true that Medicare only pays for certified home healthcare agency. So it's not just aid service that you could get through that agency. This is talking about skilled nursing. It's talking about physical therapy, occupational therapy, speech therapy. You could get a medical social worker. And these are all services that come to your home, okay? The next grouping in the middle there says licensed home care agency. Sounds very similar to what we just talked about, but instead of being certified, it's licensed, okay? In New York, a licensed home care agency can provide personal care, bathing, dressing, toileting. These services are not covered by Medicare. This is something that people are typically surprised to hear when I'm sitting with them in the office. But it's important for you to know if you're planning that this service is not something that Medicare will pay for, okay? When you're looking, again, if you go back to that needs assessment that we are looking at, these type of services are going to be, again, on the second page under personal care, okay? There's a whole listing of them there, okay? Now, if you have Medicaid, Medicaid can sometimes pay for this type of service, or if you have long-term care insurance could also pay for this personal hands-on care, okay? And the last column we have here is homemaker services and companionship. This is help around the house. Maybe it's just having somebody around. Maybe, your caretaker needs to go to a doctor's appointment and, you don't really want to be left alone during that time. That would fall under this companionship area, okay? These types of services are on the front page of the worksheet that we looked at, okay, under housekeeping and companionship. So the entire first page would fall under this column, okay? It's cooking, it's running errands, it's cleaning, doing some laundry. These services are not covered by Medicare. It could be covered under Medicaid or, again, long-term care insurance. Okay, so that was a lot of information. We'll break it down a little bit more. So Medicare does pay for some in-home services. What they're paying for is part-time or intermittent home health aid services when this is the only care you need. Okay, I'm sorry, it doesn't, excuse me, let me say that again. Medicare pays for home health aid services, but it doesn't pay for the services when that's the only care you need. So in order to qualify for Medicare coverage, you need to have a skilled need. The skilled needs would be nursing or physical therapy. Those needs would qualify you to have an aid in your home paid for by Medicare. But if you don't really have those needs, if you don't have a dressing that needs to be changed or any catheter care, and if you don't have any physical therapy needs, then Medicare will not cover the cost of the aid service. Okay. Again, that's usually a big surprise for people in my office, and so I really want to make sure that I'm clear on that piece of it. Now, the discussion about Medicaid, I am familiar with New York State Medicaid. If you are from out of state, the similar principles apply, but the details may be slightly different. So I would encourage you to follow up with a Medicaid expert in your area. The local Office of the Aging would be a good resource to find somebody for that. But as a whole, if you have Medicaid, you are eligible to receive aid service in your home paid for by Medicaid. Okay? A nurse from your Medicaid provider can come to your home and they do a standard assessment. And that assessment will determine how many hours of aid service per week you are approved for. Now here's something to be aware of though. The aid service you're approved for, you still need to have a backup plan. So what if the aide is sick that day? Or what if you're approved for 40 hours, but they can't actually fill 40 hours? They may not have enough aides available in your area to provide that much care. So it's important that you still have a backup plan, even if you are utilizing Medicaid aid service. Okay. The other thing about Medicaid is that they may also connect you with additional services, such as a medical alert button paid for by Medicaid, perhaps a day program, or Meals on Wheels. And in New York State, these services are called consumer-directed personal care services. But again, other states have similar programs that are typically have that consumer-directed part in the name. Okay. Oh, excuse me. Okay. The next slide. Here we go. So if you have long-term care insurance, it's important to contact that provider to find out what aid agencies they contract with. They may have preferred agencies that they contract with. Typically, you do need to go through an agency as opposed to just hiring maybe a family friend. If you're getting reimbursed through long-term care insurance, they will have some criteria you need to follow, and so I advise that you do that ahead of time before you contract for services. Okay. All right, so we talked about paying for assistance. Now, how do you actually find aid service? If you need that medical care, that certified home care agency care, that has to come from your doctor. If you are using any of the other services and you're expecting Medicaid to pay for it, then that also needs to come from a referral from your doctor. Okay, so that would be the first step, is to connect with your doctor, let them know you're interested in getting some aid service, and they can start the process from there. Okay. If you are not getting paid, if you're not expecting Medicaid to pay for the services and you're going to be paying out of your own pocket, then you don't need to let your doctor know. You certainly can, and I would encourage you to continue to have an open conversation with your doctor about what services you're using, but you can actually contact the agencies on your own if you're going to be paying out of pocket for it. Again, the Office of the Aging in your county can provide a list of agencies in your area that you could choose to hire. The benefits of using an agency is that they're going to hire the aides, they're going to schedule them, they're going to manage. It's really less of a logistics burden on you. But this is a little bit more expensive if you're paying out of pocket to go through an agency. Okay. The other option, if you're paying out of pocket, is just to hire an individual. This tends to be less expensive than an agency, but an increased logistical burden on you. As you need to schedule them. If there's any problems, then you're really needing to address that. If they're not showing up on time, that kind of thing. If you're interested in hiring an individual, I encourage you to ask family, friends, maybe other people from the MDA community. You can consider posting on care.com. There's a lot of different kinds of care available through this website, but it's really just a way for caregivers and people who need care to connect. And again, this route tends to be less expensive than going through an agency. Okay. The last slide here is just the Medicare website. I did reference them in an earlier slide, and also the National MS Society, since I took their needs assessment from their website. Are there any questions about this information?